Acne is one of the most common skin diseases and is affecting more than 85% of teenagers in industrialized countries. In the United States, acne persists after even adolescence into third decades of life in nearly half men and women. There are different types of acne, which I'm trying actually to explain in this slide using the laser pointer. There are acne vulgaris, simple acne, that we have some of these acnes here in the forehead area, and there are comedones, which is one or two over here, blackhead, and whitehead. Some of the whitehead could be seen in the nose area, and papules, which I'm circling one of them here, pustules that you can see here, and cystic acne that we have two of these cystic acne, a couple of them here, and mostly cystic acne leave scars, either atrophic scar, which is indented skin, and hypertrophic scar, which is red raised fibrotic tissue. We have nodules and nodulocystic acne as well. Is there any connection between food composition and acne? Well, there is a randomized control trial in South Korea, which is recently done on two groups of people. One group, more than 780 patients with acne. The other is more than 500 patients with acne again. Second group was taking more vegetables and fish mostly. And the first group was taking American Standard Diet or Western diet, which is high in glycemic load, high fat intake, and high dairy and meat consumption. And the results showed an important exacerbation factor of acne in the first group, which is high in glycemic load and fat and dairy. But how acne persists into the third to fourth decades of life. As you can see in this graph, the hyperactivation of an enzyme called mTOR by taking meat, dairy, milk, and high glycemic load foods could actually contribute to acne promoting mechanism, which persists even after puberty, and it's actually independent of endocrine signaling of puberty. And this kind of activation could cause any kind of obesity, diabetes, cancer, and Alzheimer's later in life. In this slide, you could see how hyperactive mTOR enzyme results in early onset of puberty, early onset of acne, and then persistent acne, and then could actually turn to obesity, type 2 diabetes, and even cancer and Alzheimer's disease. This is a 25-year-old female patient of mine, and as you can see, she came in with all sorts of acne, from acne vulgaris to nodulocystic acne, and also she has acne scars which is actually attached to each other and make indentation. So only with the 3 to 4 weeks of diet and lifestyle change and local treatment to activate the fibroblasts in this area to fill in the indentation here and to make more collagen to resurface the skin, we reach to this result. So what's the proper treatment for acne? I would say in most of my patients, only 3 weeks of diet, which is plant-based diet mostly, along with local treatment using the healing power of our fibroblasts, which helping to make collagen, we could get rid of more than 95% of acne on the skin of our patient, And at the same time, we reach to the successful treatment, preventing from having any kind of long-term downsides like obesity, diabetes, cardiovascular disease, or Alzheimer disease.